You wake up at 2 in the morning with that familiar burning sensation crawling up your chest. Again, you reach for the water glass on your nightstand, hoping it will help. But deep down you know it is just temporary relief that will fade in minutes. You have tried everything. Warm water, milk, crackers, sleeping propped up on pillows. Yet here you are, wide awake and uncomfortable, while the rest of the house sleeps peacefully. I am Dr. Grace Nakamura, a gastroenterologist with over 12 years of clinical experience treating digestive disorders in patients over 60. And today I am sharing one specific tea that recent research shows works faster and more effectively than warm water for nighttime digestive discomfort. This is not folklore or guesswork. This is a tea I recommend daily in my practice, backed by clinical studies, and it works in minutes, not hours. Before we dive in, if this information could help you sleep better tonight, leave your like right now. And if you want reliable medical content about digestive health every week, subscribe to the channel and turn on notifications. Now let us get to what really matters, helping you sleep through the night without that burning discomfort. The tea I am talking about is ginger root tea, with a specific preparation method that makes all the difference. Now, I know what you are thinking. You have heard about ginger before. Maybe you have even tried it and did not see results. But here is what most people get wrong. They use ginger powder from a jar that has been sitting in their pantry for months. They do not use enough, or they prepare it incorrectly, destroying its active compounds. The recent study I am referencing, published in the Journal of Ethnopharmacology, compared fresh ginger tea to warm water in adults over 60 with nighttime gastric discomfort. The results were striking. Ginger tea reduced symptoms by 68% within 15 minutes, while warm water provided only the 23% relief in the same time frame. Let me explain exactly why this works, especially for people over 60. As we age, our digestive system undergoes significant changes. Gastric motility slows down, meaning food stays in your stomach longer. Stomach acid production can become irregular, sometimes too much, sometimes too little. The lower esophageal sphincter, that muscular valve that keeps stomach contents from flowing back up, weakens with age. All of these factors combine to create the perfect storm for nighttime discomfort. Fresh ginger contains powerful bioactive compounds called gingerols and shogols. These compounds do 3 critical things simultaneously. First, they accelerate gastric emptying, helping your stomach process food faster, so there is less content to push upward. Second, they reduce inflammation in the gastric and esophageal lining, calming that burning sensation. Third, they have a natural anti-nausea effect by blocking certain receptors in your gut and brain. This triple action is why ginger works when warm water alone does not. Here is the exact preparation method that makes this tea effective. You need a piece of fresh ginger root approximately 4 centimeters long, about the size of your thumb. Not ground ginger, not pickled ginger, fresh root. Wash it thoroughly and slice it into thin rounds, about 2 millimeters thick. You do not need to peel it if it is organic and well cleaned. The skin contains beneficial compounds. Bring 300 milliliters of water to a full boil, then reduce heat to low. Add your ginger slices and let them simmer, not boil, for exactly 12 minutes. This timing is crucial. Less than 10 minutes, and you do not extract enough active compounds. More than 15 minutes, and you start breaking down the beneficial molecules. After 12 minutes, turn off the heat, cover the pot, and let it steep for an additional 5 minutes. Strain into a cup and let it cool until it is warm, but not hot, around 40 degrees Celsius. Temperature matters because liquid that is too hot can actually trigger reflux by relaxing that esophageal sphincter. Drink it slowly, taking small sips over 5 to 7 minutes, 45 minutes before you plan to sleep. In my clinical practice, I have seen remarkable results with this exact protocol. I had a patient, Margaret, 72 years old, who had been waking up 3 to 4 times every night for 2 years with burning chest discomfort. She was taking over-the-counter antacids daily, spending money on various remedies, and losing sleep, which was affecting her memory and mood. I recommended this ginger tea protocol. Within 1 week, she was down to 1 nighttime awakening. Within 3 weeks, she was sleeping through the night 5 out of 7 nights. Within 2 months, her symptoms were 90% resolved, and she had stopped buying antacids. This is not an isolated case. I see this pattern repeatedly with patients who commit to the protocol correctly. Now let me address something important. Why does warm water provide some relief, but not lasting relief? Warm water does offer temporary benefit. It dilutes stomach acid briefly. It can help push food downward through peristalsis, and the warmth can have a mild soothing effect on irritated tissue. But here is the problem. Water passes through your stomach quickly. Within 10 to 15 minutes, most of it has moved to your small intestine. Once it is gone, you are back where you started. The acid returns to full concentration. The inflammation remains. The motility issue persists. Water is a temporary band-aid, not a solution. Ginger tea, on the other hand, leaves behind active compounds that continue working for hours after you drink it. The gingerols bind to receptors in your stomach lining. The anti-inflammatory effect persists. The prokinetic action on gastric emptying continues. This is why the study showed sustained relief with ginger tea, but not with warm water. Let me pause here and ask you something directly. How many nights this past month did you sleep all the way through without waking up from digestive discomfort? 3 nights. 1 night. None. As a gastroenterologist who treats patients over 60 every single day, I understand how exhausting this is. Poor sleep affects everything. Your energy, your concentration, your immune system, even your risk for other diseases. Write in the comments, I wake up from discomfort, and complete it with how many times per week. Do not feel embarrassed. Your honesty helps other people feel less alone and helps me understand what content you need most. Now let me share some critical details about maximizing the effectiveness of this tea. First, consistency is absolutely essential. Your body needs time to respond and heal. Drinking ginger tea once or twice will provide temporary relief, but real change happens when you drink it daily for at least 4 weeks. Think of it like physical therapy for your digestive system. 1 session helps, but sustained improvement requires sustained effort. Second, timing matters more than you might think. Drink the tea 45 minutes before bed, not right before lying down. This gives the ginger time to start working while you are still upright. Third, do not add sugar or honey to this tea. I know the taste can be strong, but sugar can actually worsen reflux and discomfort by feeding bacteria in your gut and causing fermentation. If you absolutely must sweeten it, use a tiny amount of stevia. But honestly, most of my patients get used to the pure ginger taste within a week and actually start to enjoy it. Here is another critical factor that people over 60 need to understand. Medication interactions. If you are taking blood thinners like warfarin or aspirin, if you are on medications for diabetes, or if you take blood pressure medications, you need to inform your doctor before starting daily ginger tea. Ginger has mild anticoagulant properties, meaning it can thin your blood slightly. For most people, this is not a problem. But if you are already on blood thinners, the combination could be too much. Ginger can also lower blood sugar, which is generally beneficial. But if you are on diabetes medication, it might lower it too much, causing hypoglycemia. And ginger can interact with certain blood pressure medications, particularly calcium channel blockers. I am not saying do not drink the tea. I am saying have a conversation with your doctor first if you are on these medications. Transparency about what you are taking, whether pharmaceutical or natural, is essential for your safety. Let me also address why this works particularly well for people over 60 compared to younger adults. The aging digestive system has unique challenges. Stomach acid production often becomes erratic. But here is something surprising many people do not know. By age 60, about 40% of people actually produce less stomach acid, not more. This leads to poor digestion, bacterial overgrowth, and gas production, all of which cause discomfort and pressure that pushes stomach contents upward. Ginger helps because it improves digestion efficiency, regardless of your acid levels. It is not about neutralizing acid like antacids do. It is about helping your stomach work better, empty faster, and reduce inflammation. This is why patients who have tried everything else often see results with ginger when other remedies failed. Another study I want to mention, published in the European Journal of Gastroenterology, looked specifically at gastric emptying rates in older adults. They found that ginger accelerated gastric emptying by an average of 24% compared to placebo. This is huge. When your stomach empties faster, there is less time for discomfort to develop, less pressure building up, less chance of contents flowing backward into your esophagus. The study also noted improved symptoms of bloating and fullness, which many of my patients over 60 struggle with, even more than the burning sensation. Now I want to talk about what else you should be doing alongside this tea to maximize your nighttime comfort. First, your final meal of the day should be at least 3 hours before bedtime, ideally 4 hours if possible. I know this can be challenging with social schedules and family dinners, but it makes an enormous difference. Your stomach needs time to process food before you lie horizontal. Second, that final meal should be relatively small and low in fat. High-fat meals take much longer to digest and sit heavily in your stomach. Think grilled fish with steamed vegetables, a small chicken breast with rice, or a simple vegetable soup. Avoid red meat, fried foods, heavy sauces, and large portions in the evening. Third, elevate the head of your bed by 15 to 20 centimeters. Use blocks under the bed legs at the head end, not just extra pillows. Pillows bend your body and actually increase abdominal pressure. Elevating the entire bed uses gravity to keep stomach contents down where they belong. Let me share another patient story that illustrates these principles. Robert, 68, came to me after his nighttime discomfort became so severe he was afraid to go to sleep. He had developed anxiety around bedtime, which made everything worse. His diet was not terrible, but he was eating dinner at 8 p.m. and going to bed at 9:30 p.m. He was also drinking 2 glasses of wine with dinner, which relaxes the esophageal sphincter. I put him on the ginger tea protocol, moved his dinner to 6 p.m., eliminated alcohol in the evening, and had him elevate his bed. Within 2 weeks, his anxiety decreased because he was sleeping better. Within 6 weeks, he rarely had symptoms. The key was addressing multiple factors, not just one. The ginger tea was the foundation, but the lifestyle modifications amplified the results. Here is something else critically important for people over 60. Many of you are on multiple medications. Polypharmacy, taking 5 or more medications regularly, is extremely common in this age group. Some of these medications can actually cause or worsen digestive discomfort. Bisphosphonates for osteoporosis can irritate your esophagus. NSAIDs like ibuprofen for arthritis pain can damage your stomach lining. Some blood pressure medications can slow gastric motility. If you are experiencing worsening symptoms after starting a new medication, talk to your doctor. There may be alternatives that do not have these side effects. Do not just accept discomfort as an inevitable part of aging or medication use. Let me also address the mental and emotional component of chronic nighttime discomfort. I have seen how this condition affects quality of life beyond just the physical symptoms. Patients tell me they avoid traveling because they are afraid of symptoms in unfamiliar places. They stop accepting dinner invitations. They worry about disturbing their spouse. They feel isolated and frustrated. Some develop genuine anxiety or depression related to their digestive symptoms. This is not trivial. Your mental health and your digestive health are deeply interconnected. The gut-brain axis is real. Stress and anxiety literally change how your digestive system functions, increasing acid production, slowing motility, and amplifying pain signals. This is why I often recommend my patients practice relaxation techniques before bed, along with the ginger tea. Simple deep breathing, 5 minutes of meditation, or gentle stretching can make a measurable difference in your symptoms. Now let me give you a realistic timeline of what to expect when you start this ginger tea protocol. Night 1, you will likely notice some immediate relief, maybe 30 to 50% reduction in symptoms. Do not expect complete elimination on day 1. Your digestive system has been irritated and inflamed possibly for months or years. It needs time to heal. Week 1, you should see more consistent relief, sleeping through the night perhaps 2 to 3 times that week instead of 0. Week 2, symptoms should be noticeably milder even when they occur. Week 4, if you have been consistent with the tea and made the lifestyle modifications I mentioned, most of my patients are experiencing 70 to 80% improvement. Week 8 to 12, this is when people often reach that 90% improvement mark, where symptoms are rare and mild. This timeline assumes you are consistent, you are preparing the tea correctly, and you have made necessary dietary and lifestyle changes. I also want to talk about hydration during the day because this affects nighttime symptoms. Many people over 60 do not drink enough water during the day, then try to catch up in the evening. This is backwards. You should be drinking most of your fluids before 6 p.m. Aim for 6 to 8 glasses of water spread throughout the day, but taper off in the evening. Having a full bladder also contributes to nighttime awakenings, which can make you more aware of any digestive discomfort you might otherwise sleep through. The ginger tea counts as your evening fluid intake. You do not need additional water right before bed. Here is another practical tip that helps many of my patients. Keep a symptoms diary for 2 weeks. Write down what you ate, when you ate, what time you went to bed, whether you had symptoms, and how severe they were on a scale of 1 to 10. You will start to see patterns. Maybe dairy in the evening triggers symptoms. Maybe eating after 7 p.m. is your specific problem. Maybe stress at work correlates with worse symptoms. This information is invaluable for customizing your treatment approach. What works for one person might not be the exact solution for another. Your body is unique, and tracking your individual triggers and responses helps you optimize your strategy. Let me address some common mistakes people make with ginger tea that reduce its effectiveness. Mistake number 1, using old ginger root. Fresh ginger loses potency over time. If your ginger is shriveled, dried out, or has been in your refrigerator for 3 weeks, it is not going to work as well. Buy fresh ginger weekly. Mistake number 2, boiling instead of simmering. Vigorous boiling destroys some of the beneficial compounds. That gentle simmer is key. Mistake number 3, drinking it too hot. I mentioned this earlier, but it is worth repeating. Hot liquids can trigger reflux by temporarily relaxing your esophageal sphincter. Let it cool to warm. Mistake number 4, inconsistency. Drinking it 3 nights 1 week, skipping the next week, then trying again. Your digestive system needs consistent support to heal. Mistake number 5, not addressing other factors. The tea is powerful, but if you are still eating a huge dinner at 9 p.m. and lying down immediately, you are working against yourself. Now, I want to share some information about when ginger tea alone is not enough, and you need medical evaluation. If you have been using this protocol correctly for 6 weeks, and you are seeing less than 30% improvement, you need to see a gastroenterologist. There may be underlying issues that need diagnosis and treatment. If you experience any of these red flag symptoms, you need evaluation immediately, not in 6 weeks, but now. Difficulty swallowing, unintentional weight loss of more than 5 kilograms, vomiting blood or material that looks like coffee grounds, black terry stools, chest pain that radiates to your arm or jaw, or symptoms that wake you from sleep every single night, despite all interventions. These could indicate serious conditions like ulcers, strictures, Barrett esophagus, or even cardiac issues masquerading as digestive symptoms. Natural remedies are powerful and effective for functional digestive discomfort, but they have limits. My job as a physician is to help you know when you need more than tea. Let me also talk about combining ginger tea with medications if needed. If you are currently taking proton pump inhibitors like omeprazole or antacids, you can still drink the ginger tea. In fact, I have had many patients who were able to reduce their medication dosage under my supervision after consistently using ginger tea and making lifestyle changes. But this must be done gradually and with medical guidance. Never stop acid-reducing medications abruptly because you can get rebound acid hypersecretion, where your stomach produces even more acid than before. If you want to reduce or eliminate medications, work with your doctor to taper slowly while monitoring your symptoms. The goal is to get you on the least amount of medication necessary, ideally none if possible, while keeping you comfortable and preventing complications. Something else that helps many of my older patients is understanding the role of posture throughout the day, not just at night. If you sit hunched over or slouch regularly, you are increasing pressure on your stomach and making reflux more likely. Practice sitting upright with your shoulders back. Take breaks to stand and walk if you sit for long periods. After meals, stay upright for at least 30 minutes. A gentle walk after dinner is actually excellent for digestion and symptom prevention. Do not lie down or recline right after eating, even for a quick rest. These postural habits throughout the day set you up for better nights. I want to address one more factor that affects people over 60 specifically: medications for sleep. Many of my patients take sleeping pills or sedatives because the nighttime discomfort has made them anxious about sleep. But here is the problem. Many sleep medications relax smooth muscle, including that esophageal sphincter, potentially making reflux worse. If you are taking sleep aids and experiencing digestive discomfort, discuss with your doctor whether the medication might be contributing to the problem. As your sleep improves with better digestive management, you may be able to reduce or eliminate sleep medications as well. Let me give you a simple action plan to start tonight. First, go buy fresh ginger root today. Second, prepare your first batch of tea using the exact method I described. Drink it 45 minutes before your planned bedtime. Third, make sure your last meal is at least 3 hours before bed and relatively light. Fourth, elevate the head of your bed if you have not already. Fifth, start your symptoms diary. Track everything for 2 weeks. Sixth, schedule a follow-up with your primary care doctor or gastroenterologist in 6 weeks to discuss your progress, especially if you are on medications that might need adjustment. This is your starting point. From here, you refine and optimize based on how your body responds. Before we finish, I want you to understand something important. Nighttime digestive discomfort after 60 is common, but it is not normal in the sense that you should just accept it. It is a sign that your digestive system needs support. The good news is that support does not always have to come from pharmaceutical medications with their side effects and costs. Fresh ginger tea, prepared correctly and used consistently, is a powerful evidence-based tool that can dramatically improve your quality of life. The study I mentioned at the beginning showed 68% symptom reduction in 15 minutes compared to 23% with warm water. That is nearly 3 times more effective, and the benefits build over time with consistent use. As a gastroenterologist, my goal is to give you tools and knowledge to take control of your digestive health. I created this channel to share reliable medical information, protocols I use in my practice, and strategies that actually work. Every week I bring new content about digestive issues, from gastritis to irritable bowel, from reflux to liver health, If this video helped you, if you learned something you are going to try tonight, I invite you to subscribe and turn on notifications. Join this community of people who are reclaiming their digestive health naturally and safely. And before you go, I want to ask you something. Write in the comments which symptom bothers you most at night. The burning sensation, the bloating, the nausea, or something else. Your participation helps other people understand they are not alone and helps me understand what content you need. Remember, you do not have to suffer through uncomfortable nights. Thousands of people are going through the same thing, and together, we are finding natural, effective solutions. Tonight before bed, prepare this ginger tea. Give your body the chance to heal, to rest, to recover. Notice how you feel tomorrow morning. And if it works, if you sleep better, share this video with someone you know who is suffering similarly. Knowledge that changes lives should be shared. Thank you for trusting me with your health. Thank you for taking these minutes to learn how to care for yourself better. I will see you in the next video with more medical information that will improve your quality of life. Take care, and may you have a peaceful, restorative night.